Okay, so picture this: you're back at school, slaving away on a project about the Irish potato famine. Somber black and white photos, hand-drawn diagrams. It's all very serious stuff.
Right.
But what if that same famine analogy could help us understand the future of healthcare?
Yeah.
That's the unexpected journey Sheilagh Foley takes us on in her article, From Famine to Future: Workforce Planning in Modern Healthcare.
It is a powerful comparison, I think, because it highlights the dramatic transformation happening right now in Irish healthcare.
Yeah.
Just like the famine forced Ireland to adapt. Rapid advancements in technology and shifting demographics are reshaping the entire healthcare landscape.
And this isn't just like some abstract concept, whether you're a nurse on the front lines or, a tech enthusiast curious about AI's impact, or simply someone who relies on the healthcare system. And let's face it, we all do.
Yeah.
This deep dive has something for you.
What's particularly interesting about Foley's perspective is her background. She comes from the business world, not healthcare. Yeah.
Which allows her to apply classic business principles to this complex issue.
And one of the key frameworks she uses is this idea of 4 business categories: superstars, business as usual, outsource, and obsolete. She poses a crucial question: does healthcare revisit these categories often enough to keep pace with the rapid changes happening all around us?
Yeah. I mean, think about it. If industries cling to outdated models and resist change, they risk becoming irrelevant.
Yeah.
And in healthcare, the stakes are even higher, right?
Okay.
We're talking about people's lives and well being.
Exactly. So let's start with the superstars.
Okay.
Now, those at the top of the healthcare hierarchy. Traditionally, we think of doctors and nurses, and they're undoubtedly vital.
Right.
However, Foley points out that Ireland is grappling with recruiting and retaining these essential workers.
Yeah.
It's a challenge many countries are facing, actually.
Well, absolutely. The government has implemented initiatives like overseas recruitment campaigns and the Slint Care program.
Which aims to provide a more universal and accessible healthcare system.
Yeah.
But Foley argues that these solutions, while important, might not be enough in the long run.
And that's where her business lens comes in. Right? She suggests that the real superstars of the future might not be who we expect. Think AI.
Yeah.
And the engineers behind it.
Okay.
As technology takes on more and more tasks in healthcare, from diagnostics to surgery, those who design, build, and maintain these systems become incredibly valuable.
Imagine a world where AI can analyze medical images with superhuman accuracy,
Yeah.
detect early signs of disease we might miss, and even personalize treatment plans based on individual genetic profiles. I mean, the possibilities are mind-boggling.
It really makes you wonder what other superstar roles might emerge that we can't even fathom yet.
Right.
Maybe specialists in bioengineering or gene editing or even something we haven't even thought of.
The key takeaway here is that the definition of superstar in healthcare is changing right before our eyes. And that has huge implications for anyone considering a career in this field.
Now let's shift gears and talk about the business as usual category.
But
These are the essential workers who keep the healthcare system running day in and day out,
right.
often behind the scenes.
We're talking about a diverse range of roles, right? Cleaners, catering staff, administrators, technicians, allied health professionals, the list goes on and on. These are the folks who ensure that hospitals function smoothly,
Right.
patients are cared for, and the system doesn't, grind to a halt.
Foley makes a point of highlighting these often invisible roles because they face their own unique challenges.
Yeah.
Right? She talks about past difficulties in obtaining qualifications for some of these jobs,
Right.
the need for clearer specialization pathways, and the increasing demand for flexible working hours, especially as more millennials enter the workforce. And she brings up a very pointed anecdote about the new children's hospital in Dublin.
Okay.
It's a symbol of Ireland's commitment to healthcare, but also a cautionary tale. The project has been plagued by delays and cost overruns, highlighting the complexities of managing large-scale healthcare projects.
Yeah.
And the potential for mismanagement.
Yeah.
Makes you wonder, how do these business as usual roles fit into the bigger picture of healthcare transformation?
Right.
And how will their challenges be addressed as the system evolves?
That's a great question.
Yeah.
And it leads us to a crucial point, I think. If we're not careful, The focus on superstars and cutting edge technology could overshadow the needs of these essential workers.
Yeah,
And if the foundation crumbles, the whole system is at risk.
it's so true. It's like
Yeah.
building a house, right? You can have the most amazing rooftop terrace, but if the foundation is weak,
Yeah,
the whole thing will come crashing down.
exactly.
Yeah.
Yeah. It's a balancing act, isn't it? Investing in the future while ensuring the present system remains stable and effective.
Yeah.
And that brings us to Foley's next category, outsourcing.
This one hits close to home for me. Foley starts this section with a story about her experience with an aggressive debt collector that her local hospital had hired.
Okay.
She even compares him to a character straight out of a gangster film.
Wow.
It turns out the hospital had outsourced its debt collection,
Right.
and it wasn't exactly going smoothly.
That anecdote perfectly illustrates the potential pitfalls of outsourcing, right?
Yeah.
While it can be tempting to cut costs and streamline operations, by handing certain tasks over to external companies, there are inherent risks involved.
Especially in healthcare, right?
Yeah.
We're dealing with sensitive information, vulnerable individuals,
Yeah.
and the need for ethical, compassionate care. You can't just treat it like any other business transaction.
Precisely. Foley points out that areas like scheduling, data entry, and maintenance are often seen as prime candidates for outsourcing in healthcare.
Yeah.
But she cautions that it's crucial to, choose partners carefully,
Yeah.
establish clear contracts, and maintain strong oversight to ensure quality and accountability.
It's a delicate balance. On one hand, outsourcing can free up valuable time and resources for healthcare professionals to focus on patient care.
Right.
But on the other hand, if it's not done thoughtfully and ethically,
Yeah.
it can compromise the quality of care and
Yeah.
even put patients at risk.
This raises an important question for you, right?
Yeah.
Have you ever stopped to consider the role of outsourcing in your own healthcare experiences? Maybe it's the company that handles your insurance claims, or the lab that processes your blood work, or even the customer service line you call when you have a question about your bill.
It's more prevalent than we might realize. And it's something to be aware of, I think, as consumers and patients. We need to ask questions, demand transparency, and hold both healthcare providers and outsourcing companies accountable for maintaining high standards.
Absolutely. Informed patients are empowered patients. Now, let's move on to Foley's final category, and perhaps the one that sparks the most anxiety and debate.
This is where we really get into the heart of the famine to future analogy. Just as the potato blight forced Ireland to reevaluate its dependence on a single crop,
Right.
the rapid advancement of technology is forcing us to rethink
Yeah.
which roles in healthcare might become obsolete in the future.
It's a natural progression, isn't it? Throughout history, technological advancements have led to shifts in the workforce, with some jobs disappearing and
Yeah.
new ones emerging, and healthcare is no exception.
Foley uses the example of the GP receptionist,
Yeah.
a role that was once considered indispensable. But with the rise of online booking systems, patient portals, and even AI-powered virtual assistants,
Yeah.
that role is rapidly changing,
Right.
and in some cases disappearing altogether.
It's a stark illustration of how technology can automate tasks that were
Yeah.
previously done by humans, and it's happening across the healthcare landscape.
Yeah.
Think about radiology, where AI algorithms are now being used to analyze medical images with remarkable accuracy.
Or pathology, where digital systems are assisting in the diagnosis of diseases.
Yeah.
Even dispensing medications, which was traditionally done by pharmacists, is being automated with robotic systems in some hospitals. It's incredible and a little bit unnerving
Yeah.
to see how quickly things are changing.
This brings us to a fundamental question, right? Is this a temporary transition where technology simply automates certain tasks?
Yeah.
Or are we witnessing a more profound shift where entire roles in healthcare become truly obsolete?
That's the million-dollar question, isn't it?
Yeah.
And it's one that Foley doesn't shy away from. She acknowledges the anxieties surrounding technology replacing human jobs, but she also challenges us to look beyond the fear and consider the possibility.
Remember, history has shown us time and time again that human ingenuity and adaptability are remarkable. As technology changes the landscape, new roles will emerge, existing roles will evolve, and we'll find new ways to leverage our uniquely human skills to provide compassionate, effective healthcare.
So instead of asking, will my job become obsolete?
Yeah.
Perhaps a more empowering question is, how can I adapt and evolve my skills to thrive in this changing landscape.
Exactly. It's about embracing lifelong learning,
Yeah.
being open to new possibilities, and focusing on those skills that can't be easily replicated by machines. Critical thinking, problem solving, creativity, empathy, communication. These are the qualities that will set humans apart in the future of healthcare.
And here's where things get really interesting for you.
Okay.
As we move further into this famine to future transformation,
Yeah.
the the lines between these four categories,
Hmm.
superstars, business as usual, outsource, obsolete, might start to blur.
Imagine a scenario where AI systems become so advanced that they're considered superstars in their own right.
Right.
But even then, who will design, build, and maintain those systems? Who will ensure they're used ethically and effectively? Who will provide the human touch and connection that patients still crave?
It's a mind bending thought experiment, isn't it? And it suggests that the future of healthcare workforce planning isn't just about filling existing roles, it's about anticipating new roles that don't even exist yet and ensuring we have the right people with the right skills to step into those roles. And it feels like we're on the edge of a new frontier in healthcare, doesn't it?
Yeah.
And as we navigate this uncharted territory, it's crucial to remember the human element at the heart of it all.
Absolutely. Technology can be a powerful tool, but it's just that,
Yeah.
a tool.
Right.
The real magic happens when we combine technological advancements with human compassion, empathy,
Yeah.
and the art of healing.
Foley touches on this beautifully when she circles back to that initial image of the Potato Famine Project. It would have been easy to end the article on a note of anxiety about the future, but instead she uses the famine as a reminder of Ireland's resilience and capacity for innovation in the face of adversity.
Yeah, it's a powerful parallel. Just like Ireland reinvented itself after the famine, embracing new agricultural practices and industries,
Yeah.
the healthcare system has the potential to emerge stronger and more adaptable from this current period of transformation.
And that's where you, the listener, come
Yeah.
in. Whether you're a seasoned healthcare professional, a student exploring career paths, or simply someone who values a strong healthcare system,
Right.
your role in shaping the future is crucial.
Remember, healthcare workforce planning isn't just about numbers and statistics. It's about people.
Yeah.
It's about ensuring that we have the right people with the right skills, motivated, and empowered to provide the best possible care for everyone.
So let's do a quick recap of what we've learned from this deep dive into Foley's famine to future.
Okay.
We started by exploring her four categories: superstars, business as usual, outsource, and obsolete.
We then delved into how each of these categories being impacted by technology, changing demographics, and evolving patient expectations. We talked about the potential rise of AI as a superstar force, the challenges faced by essential business as usual roles, the delicate balance of outsourcing, and the anxiety surrounding jobs becoming obsolete. And along the way, we've highlighted the importance of adaptability,
Yeah.
continuous learning, and the enduring value of human skills like empathy, communication, and critical thinking. These are the qualities that will not only help individuals thrive in the future of healthcare, but also ensure that the system remains patient-centered and compassionate.
The key message here is that the future of healthcare is not predetermined.
Right.
It's something we're actively creating through our choices, actions, and willingness to embrace change.
Foley ends her article with a quote that I think sums this up perfectly. A strategist she interviews says, "Motivate the right people in the right way at the right time."
It's a simple statement.
Yeah.
But it speaks volumes. It reminds us that at the heart of any successful healthcare system are the people who dedicate their lives to caring for others. And it's our collective responsibility to ensure that those people are supported, empowered, and equipped to thrive in the face of ongoing change.
So as we wrap up this deep dive, I want to leave you with a final thought. What role do you want to play in shaping the future of healthcare? It's a question worth pondering.
Consider reading Foley's full article. Continue researching areas that sparked your curiosity, or even share your own experiences and insights with others. Remember, the future of healthcare is a collective endeavor, and we all have a part to play.
Thanks for joining us on this journey from famine to future. Until next time, keep exploring, keep learning, and keep asking those thought-provoking questions.
Yeah, absolutely. Take care.